Okay, sige, let's continue, no? So, one effect of your local or either systemic heating is an increase in capillary permeability. So, meaning to say, it permits the movement of the fluid in and outside of your extracellular compartment. So, with then enhances no the clearing of your exudates, your substrate, your metabolites. It has been constantly present on a chronic, okay, edema, for example. Okay, so remember ang effect ng heat kapag ka edema, may edema, since we're talking about capillary permeability. So we're talking about the movement of the fluid or osmosis, tama? So the amount of edema tends to increase kapag ka meron kang systemic or local heating. That's why you avoid applying heat during the first 24 to 72 hours because it encourages edema formation. Okay, but remember, although the edema is increased, okay, the capability of removing it is greater. Tama? Kasi there is an increased capillary permeability on the area. Remember, kaya ka naman nagkakaroon ng edema is because there is an increased capillary pressure, okay, and of course, no, yung mga harmful metabolites along the area or the injured area. So with increased capillary or lymphatic permeability, it aids with the reabsorption, okay, of this fluid back to the systemic circulation. So it also resolves any localized bleeding. Okay, take for example in an ankle sprain, di ba? So makikita nyo, kaya you don't apply heating modality or superficial heat immediately after an ankle sprain kasi remember, swelled yung area. Kaya naman yung nag-swell because there is an increase in capillary pressure along the area. And at the same time, yung mga pain metabolites that causes no a severe vasodilation along the area. And at the same time, okay, pag nag-apply ka ng heating modality, okay, you're just increasing the fluid formation. Okay? But in turn, ang effect naman nun is that it increases or yung removing, okay, property nung mga waste at saka yung excess fluid na yon along the area is greater. Okay? But remember, this drainage or this waste cannot be drained out of the circulation unless otherwise the venous and lymphatic channels are open. Otherwise, kung hindi open itong mga channels na to or vessels na to, the water will retain along the area. Okay? Edema would still persist. Okay? So that's why it is best apply no at 72-hour post-injury. Kahit may swelling yan, okay, remember the swelling tends to occur within the 2 to 3 days after injury. Okay? But as long as the bleeding subsides and the edema formation reduces, pwede ka na magbigay ng heating modality. Kasi ang gusto mo is to further, okay, eliminate yung fluid within the area. Same thing kapag ka meron kang may bleeding doon sa site, may ecchymosis, merong 'di ba, yung usual na pasa. Pagka meron kang hematoma formation, in order to facilitate yung flow ng blood or ma-reabsorb yung excess blood on that area kasi yung hematoma is bleeding yan, di ba? Okay, lagyan mo ng warm compress and immediately after you would see a response, ma-reduce yung hematoma formation. Okay, so same thing with your fluid. Okay? What else? So nagkakaroon tayo tinatawag nating vascular shunting. So what is vascular shunting? So it refers to the temporary closing or reduction of blood flow to one area to facilitate the flow on another area, especially those areas that are being damaged. Okay, halimbawa, meron kang peripheral vascular disease. Okay, some of your blood vessels will tend to close and shunt its flow towards the areas that has a very restricted blood flow. Okay? That is a local vascular shunting. And mangyayari lang yan kapag meron kang mga arteriovenous anastomosis. Ito yon, no? So there is a direct link. These are channels that connects directly the vessel, your arteries, and your venous channels. So ang tawag doon ay, before it gets to the lymphatic channel ha, hindi ito yung makikita natin between the blood vessel, the arteries, and your veins together with your lymphatic channels. Hindi. These are channels that connects directly the artery and the veins at whatever vessel, okay, in the body. So the purpose of these shunts or anastomosis is to protect the cutaneous tissues from damage caused by excessive heat or cold. Okay? So halimbawa, nag-apply ka ng tawag nito ng hot packs or heating packs. So because of a increased temperature or an excessive heating nung hot packs, so some of the vessels or the blood will be shunted towards your venous circulation to prevent excessive vasodilation. Okay? So yun yung purpose ng mga arteriovenous shunts na yan or anastomosis. Okay? Yeah, no, we encounter this many times. No, your reflex heating or the consensual or tinatawag nating remote heating or the Landis-Gibbons reflex. So application of heat to one area in the body that results in an increased cutaneous circulation, sweating, and hyperemia on other parts of the body. And this is best no, sa mga patients na mayroong vascular conditions such as DM and peripheral vascular disease. Okay? O halimbawa, yung pasyente mo na mayroong venous insufficiency of the lower limb. In order to increase the circulation in the area, you might want to heat up yung kanyang lower abdomen or yung kanyang lower back to improve the distal circulation. So that is consensual or reflex heating. So this graph here shows the tissue temperature increase during the first 30 minutes of application ng moist heat pack. So as you can see here, ito yung line na to. So this is the skin temperature. Yung may square would be your subcutaneous layer. The triangle is your intramuscular. Okay? And as you can see, doon tayo sa skin. Kasi remember, the effect of your heating modality is widely felt at the skin level. Tama? So, at 102 degrees Fahrenheit, or roughly around 40 to 41 degrees centigrade. Yeah, no? So as we reach the therapeutic levels, okay, which is mostly at this in this figure nasa 41 or 42 degrees Celsius. So what would happen is that there is an increase in the release of oxygen, okay, which is carried by your hemoglobin, tama? So the blood through its hemoglobin will release the oxygen, providing more oxygen towards the cell and towards the tissue or an injured tissue to facilitate the healing process. And remember, the release of this oxygen is actually twice than its baseline temperature. Okay, so at the baseline temperature, okay, at pag nag-apply ka ng heat at 41 degrees Celsius, the release of oxygen increases by 2 folds. Okay, and because that is the effect of your systemic or local heating response. Once you reach a certain level, like at 38 degrees Celsius also, nagkakaroon tayo ng enzymatic activity. Meaning to say, at this point, okay, before it reaches yung iyong wherein the oxygen would be utilized or released by your blood. So enzymatic activity happens at this level, kaya napoproduce yung mga neurotransmitter that we have mentioned a while ago, yung mga prostaglandins, the bradykinin, which is a potent vasodilator. Once you reach at that particular temperature at 38 degrees, roughly around 40 before it reach yung therapeutic levels. Okay? And heating up to 40 to 45 degrees Celsius kapag ka nandito ka na at this range. So that is actually enough to produce a plastic deformation on your collagen. Okay? However, sabi nga natin, it will be destructive or the tissues will tend to be destroyed kapag ka ang temperature mo is beyond the therapeutic levels, okay, of more than 45 degrees Celsius or 113 degree Fahrenheit. Okay? So makikita mo din dito compared with the tissue heating sa subcutaneous and sa muscle, mas mababa. Kasi nga, the depth of penetration of your HMP is actually superficial. And there is a drastic decline in the temperature after the 30 minutes of application. Okay? So the effective heating is between 20 to 30 minutes. Beyond that, you cannot achieve anything because there is a gradual decline after the first 10 minutes of application. Nagdi-decrease na agad yung temperature up to a level na that will drastically drop all the way to the baseline temperature beyond 30 minutes of application. So visceral changes. So with local heating, di ba kapag halimbawa masakit ang tiyan nyo, anong ipapalagay nung inyong nanay o kaya nung lola nyo, kukuha ng water bag, okay, na mainit, ilalagay sa tiyan. Okay? Di ba ginagawa niyo yan sometimes? Yung mga matatanda pa, ewan ko kung naabutan niyo yun, Sa probinsya, kukuha sila ng dahon, lalagyan ng langis, paiinitan sa apoy, tapos ilalagay yung sa tiyan, tapos babalutin ng tela, Ganun yung mga ginagawa ng mga matatanda dati. Actually, yung lola ko nung nabubuhay pa, nung maliliit kami, ganyan yan. Kukuha yan ng dahon ng, familiar kayo sa dahon ng tuba-tuba? I'm not sure kung na-experience nyo yun. Okay? Siguro meron pang mga parents na ginagawa pa rin yun up to this time. Di ba? Lalo sa probinsya, common yan. Okay? Although yung mga grandparents kasi although nasa QC lang kami, pero syempre the practices they had, okay, during yung mga kapanahunan nila, yung pa rin yung ginagawa nila, okay, that time. So kukuha lang yan ng dahon ng tuba-tuba, lalagyan ng baby oil or langis. Usually hindi nga baby oil coconut oil. Yan, yung coconut oil, lalagyan yan, papahiran, tapos papadaanin sa apoy, tapos ilalagay yan dyan sa tiyan mo. Kahit sa mga baby, okay, ginagawa nila yan. So to decrease yung gastrointestinal activity. So kung meron kang visceral contractions or spasm, okay, yan, to relax yung mga gut muscles natin, pwede ka mag-apply ng systemic heating. Kaya di ba kapag ka sa mga females, kapag ka you are under your menses, di ba? And you are experiencing painful menstruation, di ba? Yung dysmenorrhea na tinatawag. Di ba? To relieve you from the symptom, anong ginagawa nyo? Magla-apply kayo ng heating pad or heating bag sa inyong suprapubic area, doon sa inyong anong tawag nito? Sa puson, di ba? Para ma-decrease yung menstrual cramps. Okay? Kasi it relaxes yung mga muscles and at the same time yung inyong uterine muscles as well. Okay? Pero kung buntis yan, hindi mo pwede kasi syempre guguho ang ano niyan. Pag nag-apply ka ng local heating directly on a pregnant uterus, mapapaanak yan wala sa oras. Okay? So that's why it's an absolute contraindication to pregnancy. It decreases the peristalsis, di ba? Peristalsis is the involuntary contraction, di ba? And relaxation ng ating digestive tract para ma-propel yung food or contents from your esophagus all the way to your GI tract. di ba? So, in order to decrease the peristaltic movement of your esophagus down to your GI tract, no, pwede ka mag-apply ng heating modality. Okay? Systemic responses. Yan. Remember, kapag ka systemic, ito ibig sabihin full body immersion therapy with warm or even close to hot temperature. Okay? Warm temperature or warm whirlpool, for example. So the effect would be systemic. Okay? So because of severe vasodilation, okay, kasi buong body would vasodilate, there is a decreased blood pressure on the peripheral area. Okay? Supposedly dapat, di ba, kung local heating ito, there is increased blood pressure because of the vasodilation. But since this is a systemic effect, when you apply a heating over a local or even a large body area, it will lower the blood pressure on the peripheral circulation because of an excessive vasodilation. And if that would happen, the effect of that decrease in blood or peripheral blood pressure is to decrease the blood flow towards the brain. That's why kapag there is a reduction on your peripheral blood pressure, of course, you expect no fainting will happen if it's serious. Okay? So this effect is actually seen kapag ang pasyente mayroong high blood pressure, uncontrolled hypertension, may circulatory system disease, such as arteriosclerosis, okay? Mas common sa kanila to. Okay? And of course, in response to decrease in blood pressure, your heart will try to compensate for that decrease in blood flow, kaya nag-i-increase naman ang heart rate. Okay? And you also have systemic vascular shunting. Most of your blood vessels would shunt the blood towards your venous circulation. And if that would happen, there is a certain phenomenon na tinatawag nating rebound vasoconstriction. Ayan, ayaw natin yan. Okay, bakit? When you apply, remember, ang vasodilation, effective lang to if it's on the 20 to 30th minute of application. Beyond the 30 minutes, the maximum vasodilation actually is achieved at this range. Kaya siya laging 20 to 30 minutes. Yun yung maximum vasodilation effect on the vessels. Beyond, or if the application is continued more than 30 to 45 minutes, what would happen? The tissue would be congested. Tama? Sobrang dami ng blood vessel doon sa blood vessel. Sobrang dami ng blood doon sa area. Congested na siya. So what would happen? The blood vessel will try to respond through a vasoconstriction. Okay? At 40th to 50th, actually 30 to 45. 34 to 45 minutes of application. Okay? Beyond the maximum vasodilatory effect, okay, what would happen is what you call your rebound vasoconstriction. Okay? So if the heat application further extend, the likelihood of burn is definitely high. Even if you constrict the vessels anymore, it cannot deliver the excessive heat to other parts of the body kasi constricted na siya. So, congested ang blood doon sa area. Okay, at the same time, what would happen? The blood vessels will react by constricting, okay, the blood vessels already in response to, yan, no, kapag ka extended application of heat. Kaya you don't provide heating modality more than 30 minutes. Otherwise, you would have rebound vasoconstriction. Okay? Nakuha po ba? Any question? Okay. So respiratory response. So systemic effect or even local, there is an increase in respiratory rate. So vigorous heat is not advised for patient with cardiopulmonary problems because it would increase further the respiratory rate. Okay. Renal response, there is an increase in concentration of your phosphorus and your acid. Okay, so with renal diseases, they should not receive prolonged and frequent heat treatment. So yung mga patient na nagda-dialysis, yung may mga chronic kidney diseases, you have to rule out this condition during your history taking. Okay, because it makes the blood more acidic. Okay. Neuromuscular effects. So generally, reduction of your pain. Okay, yung primary effect nito. Relaxation of your muscle because of spasm or let's say if it's contracted for prolonged period of time. So the increase in temperature would likely to increase the nerve conduction velocity for about 7.5 meter per second following a hydrotherapy on an immersion therapy at a temperature of 44 to 45 degree centigrade. So kapag ka-cooling naman, it decreases the nerve conduction velocity. Okay? Reduction on muscle spasm, it would always end up to decrease in your gamma motor neuron. Okay? So your extrafusal fiber through the decreased firing of your gamma motor neurons. Yan naman lagi ang terminal niyan. Kasi remember, di ba, kapag meron kang spasticity, pag meron kang spasm, okay, mostly the gamma motor neuron is actually on hyperactivity. So to prevent the muscle spindle, okay, from firing, okay, and providing a sensory afferent input, okay, towards the muscle itself, muscle fibers, i-decrease natin no yung firing ng gamma motor neuron by decreasing the alpha motor neuron activity, decreasing the firing of two afferents, and increasing the GTO fibers. Okay, generally, basta na-decrease mo ang firing ng gamma motor neuron, it would result to muscle relaxation. Okay? We will not discuss that further kasi supposedly dapat na-discuss yan sa inyo, no? Yung mga nuclear bag, nuclear chain, intra and extrafusal muscle fibers, the flower spray organ. Okay? Ayan, no? So effect on CNS, kapag may spasticity, pwede nating bigyan ng local tissue heating. Okay? Also one example is yung low load stretch. Low load stretch with heat. Okay, ito previously ginagawa ko to no kapag meron kang ACL tear and yung muscle is really spasm. No, nag-spasm yung mga muscle. Ang ginagawa ko pagka ayaw mag-yield, okay, nung kanyang quadriceps. Okay? Lalagyan ko ng or siguro si hamstring for example, no, si hamstring nag-spasm, ayaw niyang mag-straighten yung knee. Okay? Meron kang lag ng let's say 30 to 40 degrees in extension. Okay? Because your hamstring is tightening, nag-spasm siya. So ang gawin mo, si patient naka-prone lang yan. Okay? Tapos nag-a-apply ako ng, kapag kami lagyan, makikita niyo talaga ayaw bumaba. No, si hamstring very spasm, no, nag-spasm 'yan. So ang gagawin mo lang, mag-apply ka lang diyan ng weights, siguro mga 3 kg na ankle weights, then maglagay ka dito ng HMP. Okay? Automatic after 10 few minutes, magre-relax 'yan. Although, okay, the patient will be feeling some pain on the knee. Okay? Kasi ang effect nun is it will relax no yung iyong hyperactive gamma motor neurons. Okay? Yan ginagawa natin to kapag meron kang mga ACL post reconstruction, okay? Yan. Kapag may spasm yung hamstring. So effects on pain. So generally presynaptic inhibition. So we're just referring to your gate control theory. Disruption of your pain spasm pain cycle. Kaya pagka tinanong kayo, ang HMP, di ba, ang hot moist pack, di ba, na-mention ko na yan last time. It also works under your gate control theory. So hindi lang TENS, okay, ang GCT. No, madaming modalities, your cryotherapy, your heating modalities also work under your gate control theory. Okay? Kunti na lang. So effect on your connective tissues. So it increases the extensibility of the collagen, decreases the viscosity of the collagen tissue, therefore allowing for the tissue to be elongated or to be stretched. Again, remember even if you achieve an increased extensibility or decrease in viscosity of the collagen tissue, if you won't stretch it, then you're not maximizing the effect of your modality. Kaya kapag after ng heating application, for example, meron kang capsular lesion, adhesive capsulitis. Diba? So if you want to improve the extensibility of your capsule or the collagens within the shoulder joint, after heating application, stretch mo yan. That is the best time. Immediately after you apply your heating modality, mag-stretch ka. Okay? So, in summary, in terms of the physical or the physiological effects of general heat application, so there is an increase in cardiac output, increase in pulse rate, respiratory rate, metabolic rate, and vasodilation after local heat or generalized heat application. Okay, and decreased blood pressure, muscle activity. So that's why it relaxes your spastic muscle, those muscles that gets into spasm, increases the blood towards the internal organs, increasing the blood flow towards the resting muscle and your stroke volume. Okay. So generally, the depth of penetration is 0.5 centimeter from the surface all the way to 2 centimeter, and it requires longer duration of exposure. So the methods of heat transfer is conduction and convection. So indication, mostly pain syndrome, muscle spasm, mild to chronic inflammation, chronic localized edema, adhesions, muscle cramping, stiff joint pain, muscle tightness, decreased range of motion. Okay? And provided that the patient is cleared from contraindications, acute musculoskeletal conditions, impaired circulation, which is a relative contraindication, skin anesthesia if there is severe numbness along the area. So you have to do your hot and cold skin test. So to check the skin sensorium, check for any open wounds or any other skin lesions. Presence of superficial metal implants are absolutely contraindicated if it's close to an area that has a very least amount of subcutaneous tissue, okay, fever, and active tumors. So yung ating clinical application, ituturo na lang natin yan yung mga how to properly check for the tank, how to set up your hydrocollator packs, how to properly wrap yung HMP kasi meron tayong different methods on wrapping, okay, your hot moist pack. We will teach you that pagdating natin sa ating lab next week. Okay? And lastly, you have your paraffin wax bath. Okay? So, konti lang to. So, ang paraffin wax bath naman, again, same thing. This is a superficial heating modality. Okay? It's through the use of a melted wax, paraffin to be exact, plus a combination of your mineral oil. Melted at a thermostatically controlled container. So, this is your paraffin unit. Okay? So it is kept at a temperature of 47 to 54 degrees centigrade, okay, the paraffin unit, and usually applied on irregular surface of the hand and foot. So take note, ang lagi lang tinatanong dito sa board exam, what is the ratio of mineral oil to paraffin or paraffin to mineral oil? And that is 1:6 or 1:7 or 7:1. Minsan yung iba 1:6 or 6:1. Again, depending on the literature. But close to that range, around 1 pint or 5 pounds, for every 1 pint of mineral oil, there should be 5 pounds of paraffin wax. Okay? O bakit po kailangan haluan ng mineral oil? Bakit hindi lang po pure na paraffin? Kung puro wax yan, remember, it's already damaging sa skin pa lang kung puro wax. Kayo, itry nyo, magpata kayo ng paraffin wax lang, walang oil. Okay? And remember, the oil decreases the specific heat. Okay? The mixture or the combination of paraffin wax plus the oil decreases the specific heat. Okay? Ibig sabihin, mas longer ang effect, okay? And at the same time, hindi sa abrupt yung effect ng heat. Okay? Compared sa water, pag ang tubig pinakuluan mo would stand at its temperature at 100 degrees centigrade and you cannot really submerge yung iyong area on a boiling water. Okay? Yes, correct. At the same time, hindi din maaalis yung wax kung wala kang oil. Okay? So somehow the oil controls, okay, your temperature ng iyong paraffin. So the method of heat transfer is also convection. Treatment time is 15 to 20 minutes kasi mabilis yung heat loss sa paraffin compared with your hot moist pack. So to minimize yung heat loss ng iyong paraffin, what we will do is sa clinic, ang ginagamit natin, during my time, ang ginagamit namin is, wax paper. Okay? I-wrap namin yung, di ba, na-dip mo na. Then, after ma-create ka ng 8 to 10 layers of glove paraffin, so ganun siya, kadami. 8 times to 10 times mo yan i-submerge sa paraffin. Okay? Until you develop a glove, hand, then cocoveran mo yan ng wax paper. So to minimize yung heat loss kasi mabilis mag-dissipate yung heat mo. Okay? So kaya next meeting magdadala din kayo ng wax paper kasi hindi ko alam kung marami tayong, probably wala yan, kung meron man kakaunti. Wax paper that could cater yung buong klase. Kasi tuturuan namin kayo kung paano mag-apply ng paraffin. Although ngayon, so makikita nyo pag pumunta kayo sa mga spa, saka sa mga salon, may makikita ka na doong paraffin wax. Tama ba? Especially the females. Kasi sila yung palaging nagpapagawa ng kamay. I mean, nagpapagawa ng mga ng mga tawag nito, manicure, no? So makikita nyo yan doon sa mga salon, sa mga spa, meron na mga paraffin wax. Okay? So generally, the paraffin is good in heating the distal extremities because it maintains a good contact, no, between the irregular contoured areas. Unlike your HMP, kasi hindi mo naman mako-cover, let's say for example, yung web, 'di ba? Hindi mo siya mapapainitan through the use of your hot moist pack. So especially sa hand, paraffin wax yung ginagamit natin to increase, no, yung surface temperature. But to effectively hit, okay, the joints and the muscle of the hand, so depending on your goal. Kung ang goal mo lang is to hit up the superficial tissue, then you would use paraffin. Pero kung gusto mo, let's say for example, ultrasound yung mga deep muscles of the hand, like the interossei, the lumbricals, no, then gumamit ka ng ultrasound. Okay, so doon na papasok yung inyong clinical decision making kung ano bang gagamitin mo. In the first place, magkaiba naman siya ng indication, and at the same time, magkaiba din siya ng physiological effect. One is superficial, the other is deep. Okay? Same thing with your hydrocollator tank. It was encountered several times on the board exam, itong mga numbers na to. Okay, depending kung saan nila nilift. Okay, I'm not saying that you have to memorize, but at least you'll be familiar with this number. 40 to 45 degrees centigrade, you maintain the paraffin tank at that range. Okay, the melting point of the wax, take note, okay, it's between 53.2 to 54.4 degrees centigrade, okay, to initially melt. And then you have to maintain the temperature at 40 to 45 degrees centigrade. Siyempre, tutunawin mo muna yan, kaya kailangan mo na mas mataas na temperature. 54.5 according to Miklovitz. So the ratio, again, it's either 1:7 or 1:6. Using a mineral oil, technical white number 12. Yan yung exact na mineral oil na ginagamit natin sa clinic. Or it is 25 kilograms of wax per 5 liters of oil, or 12 ounces of oil per pound of wax. Okay? Naku, lagi yan tinatanong sa board exam, ha? Itong mga to. What is the ratio of mineral oil and wax? Hindi nila sasabihin yung ratio, but rather the kung gaano kadami. So 25 is to 5 liters or 12 ounces per pound of wax. Okay? So the physical characteristic of wax, it has a very low thermal conductivity, it has a very low specific heat, and it's self-insulating. Okay? So meaning to say, yung melted state ng wax itself would allow for even distribution ng heat coming from the wax to the site or the body part to be treated. Second, it has a very low specific heat, meaning to say the patient doesn't feel as hot as a water at the same level. Okay? So if you compared 45 degrees Celsius of water compared with your paraffin, mas mababa ang perception ng patient under paraffin compared sa water at the same temperature, therefore decreasing the risk for burn. And at lastly, it conducts the heat more slowly than the water at the same temperature, thus allowing the tissues to heat up slowly and at the same time decreasing the risk for burn. Okay? So biological effects, it increases the skin temperature for about 8 degrees Celsius. The first 2 minutes of application, there is a rapid increase to about 12 to 13 degrees centigrade. The subcutaneous tissues can be heated to 3 to 5 degrees Celsius, and superficial muscle only about 2 to 3 degrees centigrade rise in temperature. And one of the most common question na nai-encounter natin in clinics and in the board exam. What is the bactericidal temperature of your paraffin wax bath? Okay? It has to be heated kasi syempre, no? This is direct immersion. Kaya the paraffin wax sa katagalan, instead na clear yan as water, nagiging brown to that color. Off-white to brown color. You expect it's because of yung mga dead skin cells na dumikit dun sa wax. Kapag natuyo yan, ibabalik mo yan. Hindi yan tinatapon. Okay? Ang wax, kapag ka nagamit sa pasyente, hindi po yan tinatapon. Ibinabalik lang po yan dun sa tank. And then, once in a while, kapag ka every week, okay, kailangan i-turn on natin to its bactericidal temperature for at least 1 hour. 82.2 degrees Celsius to 93, almost boiling point. Pero hindi mo naman pakukuluan yung wax, no? Nakuha? Kasi hindi naman tayo palagi nagpapalit ng wax kasi mahal ang wax compared with your hot moist pack. Okay, kaya ginagamit lang natin ito for wrist and hand and ankle and foot. Actually, sa ankle and foot, hindi nga. You don't want to submerge the foot and then later on, a patient will come, then sa kamay naman gagamitin. Okay? Hygiene practices and for contamination to decrease, actually, or to eliminate the contamination. Actually, di man natin mai-eliminate talaga yun kasi every now and then may lumulubog na kamay dyan. Okay? Yan, no? Kaya, you instruct your patient also na bago mag-start ng paraffin wax bath, isa sa kailangan is naghugas ng kamay with running water with soap. Okay? What if, for example, kakatapos lang ni patient tawag nito, mag-eliminate ng bowel. Okay? O nakalimutan niya maghugas ng kamay. Ay, teka, meron pala akong therapy ngayon. Immediate, ilulublog niya ang kamay niya doon sa so dapat it's your task or your duty as a therapist to minimize these contaminations, no? I-instruct niyo si patient maghugas po muna ng kamay bago maglublob sa paraffin wax. Okay? So indication, your paraffin wax is indicated for subacute and chronic inflammatory conditions involving mostly the distal regions. Example, arthritis of the fingers and toes and limitation of motion after immobilization. So yung mga nagkaroon ng fracture sa wrist and hand na kailangan nilang makast for prolonged period of time, yung mga nagkaroon ng malleolar fracture, na mga stress fracture sa metatarsal, yan, no? Pwede natin silang bigyan ng superficial heating. It's contraindicated to acute, impaired circulation, almost the same, no, with your hydrocollator packs. Of course, don't forget hot and cold testing also to test for skin sensation. Okay? So advantages ng wax, again, we have mentioned some of its advantages. Mababa ang kanyang specific heat at a higher temperature compared with water. So low thermal conductivity. So the heating occurs slowly compared with warm water at the same temperature. Okay. The molten state allows even distribution to the areas. Okay. Oil used in the wax add moisture to the skin. Okay. And wax remains malleable after removal, allowing for use as an exercise tool. No? Para siyang putty. Hindi mo siya putty kasi yung putty kasi para siyang slime, di ba? Ito, pagka halimbawa after application, si patient, tatanggalin natin yung wax, ibibigay natin sa kanya yung wax, and then it would act as a sort of an exercise tool. Pwede nating i-facilitate yan for gross motor gripping, or sometimes, ako pinapagawa ko, liit-liit ko, pinapabilog ko yung mga paraffin para fine motor skills naman. Okay? And then after that, ibabalik mo din yun. No? Hindi po yung tinatapon. Okay? And replacing wax is relatively inexpensive. Assuming bath is already owned. Ibig sabihin, compared with your tanks, no, yung Whirlpool, Hubbard tank, although the effect would be the same, okay, mas mura naman, no? Kasi sa tank, magpapalit ka talaga ng water. Kailangan mong punuin yung tank, no? Mas ano 'yun, mas cost ineffective. Okay? Yung disadvantages lang, syempre, for distal extremities lang. Okay, most effective method of application is yung bath method. Yung bath method, submerge to. Ilulubog mo siya for 20 minutes. Okay? So, no method to control the temperature once applied. Okay? So, that's why your thermostat ng tank mo dapat, ng paraffin unit is actually controlled at 40, 44, 45 degree Celsius. Okay? At that range, 40 to 45 degrees Celsius. Okay? And remember, this is a passive intervention. The patient exercises cannot be performed simultaneously. Again, these modalities, whether it's superficial or deep modalities, are all under adjunct modalities. They are not developed for the purpose of being a standalone approach, but rather this is just to augment for your treatment, because at the end, the patient would still spend the time doing active procedure and exercises. Okay? Sige. And remember, yung clinical application nito, tuturo na lang natin pagdating sa lab kasi meron tayong different methods on how to apply yung paraffin. Meron tayong dipping, meron tayong dip and wrap, meron tayong painting or brushing technique, meron din tayong gloving technique. Actually, 4 yun, no? Didiscuss na lang natin yan pagdating natin sa lab. Okay? So, any question? May question po ba? So, next meeting po ha, each of you should bring your towel for hygiene purposes. Okay? Yung mga Turkish towel, yung makakapal. Okay? Yung makakapal po na towel, wag yung maninipis. Second, magdala din ng siguro kahit isa lang na wax paper para sa buong klase. Wax paper ang gagamitin natin. And may maliliit na towel naman tayo doon. Wax paper lang. And please magupit kayo ng kuko. Bawal ang long nails, especially sa paraffin. No, susuot yung mga paraffin wax doon sa kuko. Tapos hindi naman yan malilinisan agad. So yung mga lupa mo sa kuko mo, no, didikit yan sa paraffin wax, sasama pa yan doon sa ano. Kaya wag please cut your fingers. I mean, you cut your fingernails, not your fingers. Okay? Your nails. And then, ano pa ba ang kailangan dalhin? For next week, sino bang in charge for the lab borrowing of the equipment? Pakisabihan po si Ma'am Jill to prepare the hot moist tank, hot moist hydrocolator tank. Pakipalitan kamo po ang tubig. Baka mamaya yung tubig nun ay nakaraang taon pa. Okay? Baka may mga lumulutang at saka may mga lumalangoy na doon. Hanggat maaari sana pakisabi malinis bagong palit yung tubig. Second, paki-check yung what's happening? Paki-check yung hydrocolator pack kung may butas. Okay, kamo paki-check baka meron dong may butas, baka may malapnos kapag kami nag-leak na clay. And ano pa ba? Yung paraffin wax, kamo sino po ba naka-assign sa inyo? Sa pag-coordinate sa lab kay Ma'am Jill. Sige si Miss Miss Santos, paki-take note po ha. Then endorse na lang din sa susunod na section kapag tapos. 'Di ba una kayo? Tama ba? Okay. So, ayun, no? Kailangan natin paraffin. Kung ilan yung paraffin natin, much better. Kung may dalawa tayo, sige. Kung isa lang, wala namang problema, no? And then, towels, yung mga maliliit na towel for paraffin. Don't forget to bring your Velcro straps, okay, to secure yung ating mittens doon sa inyong wax. Okay, Velcro strap. Ito pa ba? Bak, meron ako nakalimutan. And siguro kung kakayanin ng time natin, isasabay na din natin ang cryotherapy. Okay? Although hindi pa natin na-discuss yung physics and yung physiological foundation ng cryo, madali lang naman yung cryotherapy. So, sige, isabay na lang din natin para kasi kakaunti lang naman ng HMP. Paraffin, madali lang naman. Kaya. Sige, I will ask Ma'am Mabel first kung kakayanan natin mag-cryotherapy kasi kailangan nating mag-prepare ng ice. Okay? Kailangan natin ng ice lolly. Ipapa-prepare ko na lang 'yon kapag makakaya nating isingit. Otherwise, sa susunod na meeting na lang. Kaya lang maiiwan kasi siya. After this topic, ang next natin would be massage. Therapeutic massage. Okay, so kailangan matapos na natin yung cryo. Okay, sige, ganito. Isabay na lang din natin ang cryotherapy. Mag-prepare po ng ice lollipop. So, paano yung ice lollipop? Kuha lang kayo ng, di ba meron namang freezer doon sa lab? Pakisabi na lang kay Ma'am Jill kung pwedeng mag-prepare po ng ice lollipop. Okay, for ice massage. Ano lang yon, sa isang plastic cup or sa isang coffee cup, lalagyan mo lang yun ng tubig at lalagyan mo lang din siya ng tongue depressor sa gitna. Then you will freeze it overnight. Meron ka ng ice lolly. Okay, ginagamit natin yun for ice massage. Okay? At the same time, hindi ko alam kung meron tayong cold packs. Pakisabi po, pa-prepare din ng cold packs. Oil, hindi na po kasi nakahalo na yon. Nakahalo na yung paraffin wax at saka yung mineral oil. No need. Okay? Sige. Yung ice, kailangan natin ng siguro magdala ng ziplock. Pwede tayo kasing kung wala tayong pack, ganito po ha, kung wala po tayong cold packs sa lab, kailangan magdala tayo ng ice at saka ng ziplock bag. Kasi gagawa tayo ng sarili nating ice pack. Pero kung meron namang cold pack sa lab, okay na po yun. Okay? Nakuha po ba? Doon na lang tayo bibili siguro sa 7-Eleven o kaya sa pinakamalapit. Di ba may Pure Gold naman sa tabi? It would last for your session naman. Wala namang kaso. Okay? Pero we prefer sana yung crushed ice over tube ice. Kung wala tayong cold packs ha, kung wala lang po tayong cold packs. Hindi ko sure kung may cold packs tayo sa lab. Kaya pa-double check. And then Miss Santos, inform ako kung merong cold packs. Otherwise, kailangan nyo magdala ng ice at saka ng ziplock bags. Yun lang naman kailangan eh. Oo. Sige. Meron pa po bang question? Hand soap. Magdala din po ng hand soap, no? Syempre for hand hygiene bago kayo bago niyo ilubog yung kamay ninyo doon sa wax, magugas ng kamay, siguro naman may hand soap sa lab o kung wala, magdala na lang ng hand soap. Okay? Sige. Any other question? Meron po bang concerns?
Recording stopped.
Okay, o sige, kung wala na pong question, then maybe you can turn on your cameras for the attendance. Hindi mag-open ng camera, absent lang to na ha. Absent kayo. Pagka sabihin wala kayo sa inyong screen. Sabihin natutulog kayo. Okay, sige. Hold on. Okay, sige po. Thank you so much everyone. Then see you all next week for our limited face-to-face classes.